Okay, so this week's surface anatomy, we're going to be looking at the sternocleidomastoid, often shortened to SCM. So our sternocleidomastoid, both sides of the neck there, when it works bilaterally, so together it brings our chin to our chest, it rotates the head to the opposite side and does lateral flexion to the same side. And so our bony landmarks for our sternocleidomastoid is the sternum, clavicle, and the mastoid process. It's got two heads. Yeah, so the sternal head comes from the mastoid process down onto the sternum, and the clavicular head comes from the mastoid process onto the clavicle. In terms of pain referral patterns from trigger points, really quite unique. It creates something called autonomic phenomenon. So things like runny nose, watery eyes, sneezing, really headache type muscle. So a unique pain pattern around the eye, bullet points into the eye, as well as a cap on the top of the head and the back of the neck. So a really important muscle to locate and to work on. So if we look on our person here, so we've got the mastoid process. So if we just come slightly posterior there to the earlobe, and we can palpate, yeah, that mastoid process. And the sternocleidomastoid then comes down here, and we come into the sternum there and the clavicle. Yeah, it's our sternocleidomastoid.